Thank you, Senator, Leader of the Opposition, my colleague, members of Parliament, journalists here, those who are tuning in, good morning. I also wish to greet those who are tuning in merely with the disgraceful intention of trying to distort what we say and to edit clips to present a false narrative to suit their own agenda. I greet those who have spent their lives playing politics to stop playing politics with people's lives. Today, I give you an update, having met with the technical team at the Ministry of Health, the minister himself, and being on the ground, conducting missions, meeting with persons who are actively involved in trying to improve and assess the health situation in the most badly affected Western parishes. We must give what is due to Caesar. The Ministry of Health has, in fact, done quite a bit, as Dr. Campbell had said earlier, in terms of being responsive to deploying some of the clinics and the restoration of services at some clinics and the improvement of the infrastructure of some hospitals, such as Cornwall Regional Hospital, having now had a roof uh, replaced by Médecins Sans Frontières or Doctors Without Borders. We, however, are very concerned about whether or not public health care is getting the attention it deserves. We have to understand that the crisis that is unfolding now out west, it is not merely the realm of the Ministry of Health and the technocrats, doctors, nurses, and vector control workers, public health inspectors. It is not under their control. What is happening is that it is a multidisciplinary, multifaceted approach that is needed to stave off the impending crisis. We are already in the midst of a leptospirosis outbreak, and we could have seen this coming. We ought to focus not only on trying to send out information to say avoid streams and water, avoid uh, rodents, but we ought to look at how we can address the environmental factors that are causing this outbreak. Garbage collection is an issue. It is piling up not just out west, but across the island. Even in my constituency, that was largely spared from the brunt of the hurricane. Water is an issue. We heard from the MPs that water is rising in some areas. There is a stench of dead animals, and you cannot simply say to people, avoid contaminated water, when that is the only water that they have available. So we have to look at the cleanup, we have to look at the access, and it is this multimodal approach that we're going to have in tandem with the work of the Ministry of Health that is going to stave off a worsening of the leptospirosis outbreak, as well as try to mitigate, if not completely avoid, the threat of dengue and chickpea. When we speak about leptospirosis being an issue, it is a disease that is largely mild, but when it gets bad, it gets bad. And it can lead to death because of liver failure, bleeding out, renal failure. And therefore, early diagnosis and treatment is essential. Questioning the capacity of the Ministry of Health to adequately confirm cases of leptospirosis? Do we have the capacity locally to test for leptospirosis? Uh, what thoughts are being given to deploying rapid kits into affected areas where we can test for the antibodies that are elevated when you have an acute infection? Early testing helped in COVID, and anyone with a passing knowledge of medicine understands that the earlier you intervene in a disease, the better the outcome, as well as the less likelihood you will have long-term complications. So we need to be testing. To say that we have 11 cases of leptospirosis begs questions. Are we testing enough? Are we missing cases? And if we are faced with a national outbreak, uh, can we ramp up testing to have results back to see whether or not the case that we're dealing with in front of us as a physician is really leptospirosis or not? So we need that information from the Ministry of Health. And what are they saying about the use of rapid kits that can be made available at clinics and even with partnerships with private doctors, as well as distribution through volunteers who are going into the communities conducting medical missions. There are still critical shortages of basic medical supplies, manpower, and of course, functioning equipment, some of which would have been damaged during the passage of the hurricane. We know that there are patients who have lost medication because they do not have a fridge that is working, because they do not have a generator. And therefore, you have to be concerned about non-compliance as a result of these socioeconomic factors that are now more than ever playing a role in healthcare. We have gotten some complaints about the process to facilitate missions. There seems to be a lack of coordination on the ground, even if persons are fully registered and they have been listed as partners. They still face some obstacles, whether or not the team on the ground were expecting them, and who are they partnering with to mobilize the people in the community. In many instances, if the members of parliament are not a part of the mission initially, they do not have the wherewithal to rapidly get out persons and mobilize them to take advantage of the free medical services. So again, this is an echo for partnership and not just trying to have hegemony over the relief efforts. And this includes the medical missions. Now, when we speak about the way forward, because this is not going, the situation that exists on the ground is not going away anytime soon. There are too many people who are homeless. There are too many people who are marginally living on the fringes of survival. And as a result of that, the conditions that exist for leptospirosis to continue and for dengue and chickpea to have outbreaks here, we're only 90 miles away from Cuba, and they have more people with with dengue and chickpea than there are people living in Jamaica, over 3 million. Um, the conditions exist and they will continue to exist for a while. So we have to plan accordingly. We cannot wait until we see a spike in cases and then we have a knee-jerk reaction. We must be able to anticipate that there will be an outbreak, there will be a spike, certain communities will be affected more likely than others, and we try to stave it off and put in mitigating measures. I don't believe in relying on PAHO. Cuba is dealing with their own epidemics right now. They have best practices that, because of the relationship for quite some time, they're willing to share with us. Let us call on the Cubans for help. They have a very good system where they look at the environmental factors. Is there a lot of garbage? Is there a lot of stagnant water? Is there increased rainfall in the area? All of which we know has been described as happening out west. You look at these environmental factors, you look at the behavior of the people. Are they bathing in the rivers? Are they using exposed to contaminated water? You look at their access. Do they have access to healthcare, access to public education, to resources? If they get sick, they can report in or go to a hospital. And of course, you have to look at the history of the area. There are some places in Westmoreland that have a history of typhoid. Now, when you factor in all of these determinants that contribute towards an outbreak, you go in, you engage community leaders, you launch public education campaigns, you clean up the place, sanitize, ensure that you have adequate garbage collection, ensure that you have potable water, you treat breeding sites, you do fogging, get rid of the vectors, and then you may reach a point where you do not have a spike in cases. And that is real primary prevention. That is the basis of public health, which has been proven to work over 100 years now. So maybe 200 years from the cholera epidemic in England. So we want to entreaty those who are in charge of the, the disaster recovery to employ early warning systems for healthcare now, not just surveillance to say that you have spikes, but predicting the likely locations of outbreaks and intervening. And to do that, you must combine environmental data, behavioral patterns, historical um, outbreaks, and you must also ramp up testing capabilities, confirmation testing, as well as introducing rapid testing. And with that, we can have early intervention, the simple penicillin that can save lives in the case of leptospirosis, or the treatment of renal failure with fluids early out. Dengue, you identify when it has become the hemorrhagic fever where you're bleeding out and have early intervention as well. And we must have a mechanism where you have real-time reporting of fever. If you have a fever, there must be a way for you to report that you have it so that you can get tested. Vector control has to be uh, augmented by private contractors, bringing in back the part-time workers, but the schedule for vector control cannot be such that communities, such as mine in Southeast St. Catherine, basically have fogging once every 2 weeks at best, and we have 18 communities, and we are plagued with mosquitoes in Portmore. So we have to ramp up vector control immediately, and because garbage pileup leads to rodent infestation, we have to ensure that garbage is being collected across the island in a timely manner. For communities where you cannot effectively solve the issue, especially if there's rising groundwater, evacuate the residents. Get them out of the conditions that are going to lead to respiratory illnesses, waterborne diseases, as well as those that are vector-borne. And of course, you have to, and this is echoing the call of all my colleagues, do not try to do it alone. Engage both sides of the political divide, engage community-based organizations, the church, community leaders, get everybody on board to identify the most vulnerable, to pinpoint the areas where you have to have a heightened presence. And this is the only way we can have an effective response. We may have to consider looking at the distribution of mosquito nets and repellents to avoid persons who are living outdoors and in shelters getting bitten by mosquitoes. And of course, the Ministry of Health has to anticipate that if all of these measures fail, what we're going to have a surge in patients coming into the hospitals. What is the surge plan in terms of bed capacity, in terms of staffing, testing, and treatment? We have to have a preparation, a plan in place for the worst case scenario. And then, of course, rehabilitation, especially when it comes to CHIKV, is important for long-term productivity and pain control. And in all of this, I left this for last. Mental health. People are numb now. They are not feeling and processing what is happening. You cannot have a psychologist or a mental health team going out and tell them better must come and then send them back to their tarpaulins to live. We must have coupled with mental health checks and interventions hope for the people that their conditions will be improved in very short order, and we're not forgetting about them when the news teams have left and they are on their own, and we're looking at this situation as a 9-day wonder. we must have interventions coupled with the psychological effects, psychiatrists getting involved. All of this must be complemented by improvement, tangible improvement in their lives, so you give the people hope. This is where I leave it. This is what is happening on the ground. This is what we must prepare for. And if we don't prepare for it, we can have the expectations that we will pay for it in lives. Thank you.